Hi, let's continue on the topic about working outside a clinic. So as a healthcare practitioner, we are having chance to work outside the clinic. For example, when you are taking job as outreaching services, or when you are working as a practitioner in a senior home, sometimes we need to work outside the clinic. And that is more complicated when compared to working in a clinic that you can engage a routine cleaning procedure. In a clinic, we can normally clean up everything before or after serving a patient so as to cut off the infectious chain and also to maintain the health and safety standard. However, when we work outside the clinic, we still have to meet the health and safety standard that are equivalent to working in a clinic. And that makes things much more complicated, as we can't expect how bad or how good the hygiene standard is the environment. So they can either be very clean and suitable for performing treatment, or it can be worse and dirty and unhygiene that we can't perform a proper treatment. We must establish a clean and sterile setting as if we are working in a clinic. That includes equipment that can be disinfected or sterilized, and instrument and materials can be stored temporarily in a clean environment, and the clinical waste or user sharp or linens that we used can be stored temporarily but safely. So here is a video that we can look into. It will introduce how to create a clean site when we work in an unfamiliar settings.
Very good. Let's talk about setting up a clean field. So when doing acupuncture, it's very important that we maintain a clean field, that we maintain our instruments, our acupuncture needles, and all the things associated with giving the acupuncture treatment in a clean environment. So the thing to remember here is that clean is the operative word. This is not a sterile needling procedure. It is a clean needling technique that we're trying to maintain. So the first thing to set up is to set up the clean field. And before setting up the clean field, we need to make sure that our hands are clean. So you need to inspect your hands to make sure that your hands are in fact clean, that there is no obvious dirt on your hands. And if that's the case, then cleaning your hands with a hand sanitizer is perfectly acceptable. So hand sanitizer will come in a liquid form, but it also comes in a convenient moist towelette, which is a possibility. If we open these up, we can find towelettes that are moistened with hand sanitizer, and those can be used, or we can just use the liquid, which is what I'll use today. So a few drops of the liquid, and remembering that in hand washing, friction is important, friction as well as the liquid that you're using. So make sure that you wash between your fingers. Make sure that you wash in and around your fingernails. This is very important with soap and water, but also with the hand sanitizer. And you want to keep using friction with your hands until the hand sanitizer has evaporated. The next step is to set up the actual clean field. So we will take a clean paper towel. I'll use a 3-fold paper towel here, which, while it may seem a bit small, it's perfectly adequate. We only have a few things that actually go on a clean field. So one of the first things that we'll put on a clean field will be some alcohol prep pads. We use alcohol prep pads to prepare the acupuncture points on the skin. A small wipe with an alcohol prep pad is fairly standard. We will talk about that in more detail in other parts of the program. But alcohol prep pads can go on the clean field, and as well as dry cotton balls, which can go on the clean field. We will use alcohol prep pads to prep the point prior to needle insertion. Clean, dry cotton balls are oftentimes used to what we say close the acupuncture point in order to prevent any excessive bleeding by pressing on the point if there should happen to be some bleeding. And also, it being a dry cotton ball, it will protect the practitioner from a few drops of blood that might come out of an acupuncture point. Acupuncture needles will also go on the clean field. However, we would not want to set a box on the clean field because the box may very well not be clean. However, the needles inside should be assumed to be clean. We can take those needles out and those can be placed onto the clean field. Other things that may go on the clean field would be instruments such as a non-invasive acupuncture point stimulator, perhaps a ear probe, or you might want to have need for a pair of forceps. So something like that. Anything that's clean can go on this field. However, once it's been used, for instance, if we're going to be needling some acupuncture points and we're going to be using some alcohol prep pads, it's not unusual to set up an alcohol prep pad, for instance, like this on the field so that you can, when the time comes, let me just open that a little better, you can reach in and grab your prep pad and clean the acupuncture point. We can use a small demonstration model here and clean that acupuncture point. And then we would want to dispose of this prep pad and the packaging properly in a trash barrel. The same thing goes for an acupuncture needle. When we open up the needle, we have the packaging, and after the packaging, we have the insertion tube and the needle. If we put the needle into the patient, then the insertion tube and the packaging both need to be disposed of, not back onto our clean field, not in a pocket, for instance, because if we touch anything with our hands, like your clothing, your pockets, your hands will become contaminated, need to be washed again. So a proper open trash barrel, something that you can step on, that you can work without using your hands, would be appropriate. The other things that will go in and around a clean field, but not on the clean field, may be, for instance, your hand sanitizer. That would not go on the clean field, but would go perhaps next to the clean field. You notice that I'm using this demonstration needling pad. I'm not putting that on the clean field, I'm putting it near the clean field. The same thing will go for a biohazard container. Biohazard containers are going to want to be in the vicinity of your clean field, most likely, because that's where you're working, but certainly they don't want to be touching the clean field. We don't want to contaminate this area at all. Once we're finished with the treatment, we can take these things off. Things that are clean could go back into the box or into the packaging from whence they came. And speaking of that, alcohol prep pads, acupuncture needles, and dry cotton balls are best taken directly from their original packaging and put onto the clean field. However, if you are transporting these items around and carrying them in their original packaging is inconvenient, they can be taken from their original packaging and put into clean Ziploc baggies and then taken from there and placed onto the clean field. And I think that does it for the clean field. Let's move on.
All right. So in conclusion, preparing a clean field is the first thing we have to do uh, when we are working in outside of a clinic. So first of all, you have to choose an area which is relatively clean, and you assume that it's clean, and we set up with a clean lining to to make a boundary to a clean field. Before preparing the clean field, first of all, you have to clean your hands. Washing hands with water and soap would be perfect. But if it is visibly clean, no visible dirt has been observed, you can wash it with the alcohol-based hand rub, as we have discussed in the previous lesson. But of course, as you can see in the video, it is more recommended for you to take off all the accessories on your hands so that you can clean your hands more thoroughly. So after you have washed your hands, you can select the area for the clean field and clean and dry the area thoroughly. And then secondly, you have to wash your hands again because you have done the sanitizing procedure that involved touching the originally dirty area. So you have to wash your hands again. And after that, you cover the chosen area with your clean filled linen or equivalent. For example, in the video, he used three-fold tissue, paper tissue for that. But alternatively, you can use anything that you assume it's clean. It's just a lining. And make a boundary on the clean field so that you know what to put inside. And after that, you can arrange the clean materials and instrument on the clean field. For example, the acupuncture needle, dry cotton ball, and alcohol props, forceps, or anything that you think that requires sterilization or at least it has to be clean. But remember, don't put anything that you know it's dirty on the clean field because you surely don't want to contaminate that area once it has been set up. So open the storage bag and remove item in such a way as to minimize handling. So with your clean hands, open the storage bag and place everything on the clean side. And it is more recommended to be taken out from an original packing so as to minimize the handling. But of course, if the package is too bulky, sometimes before you get off from your clinic, you would prepare them in a Ziploc bag or on a travel package. That is still acceptable as long as the packing is clean. Then in this case, you will have to take out those things on those packing. And after that, remember to place a shop container and waste bag that is away from the clean field. Well, in the video, it demonstrates that it is in a handful distance that you won't have to travel all the way down and waste time, but it's recommended to at least separate them. So for the sharp container, it is recommended to use a standard weight sharp container as shown in the video. But if that is not available, one of the alternative option will be those glass bottle or the plastic bottle, which is hard and solid enough to prevent the perking. Okay. For example, I mean the poking. So, for example, one of the example will be those the container, the plastic container of the TCM herbal powder. In most of the case, those bottles are strong and rigid, and it is not that easy for the used needle to penetrate through it. So it's also one of the optimal container for the waste. But remember, don't put anything else other than the used needle or used sharps, right? Okay. So the key point to work outside the clinic is to maintain a safe and clean treatment area. And it doesn't only involve cleanliness, but also for any other criteria that allow you to perform a safe treatment. For example, adequate lighting is also crucial. Sometimes when we are work in somebody's home, and the home is not always as light as uh, as um, as you can expect. Sometimes people would like their home to be looks a little bit more warmer, and it would use dim light, and that would be an issue when we are treating patient. We have to see things very clearly when we perform acupuncture, especially when we involve those fine needles. And especially for on those sites that is not easily to be seen. For example, when you are performing scalp acupuncture and you are needling the patient's scalp with a perpendicular insertion. So in that case, We will certainly need an adequate lighting for us to see things clearly. Otherwise, there will be a larger increased risk for us to lift the needle on the patient's body. And also, we have to access the sanitary hand washing facilities easily. If we can't, if we are not able to perform those hand washing, at least uh, you have to make sure your hands are clean, visibly clean, so that you can clean your hands with the alcohol-based hand rub. In many practitioners' habits, they used to pack the equipment that on into a travel pack. So there are a few categories of supplies and equipment. Something it has to be sterilized, something is not necessary to be sterilized, and and sometimes also involve those things that are not medically related. For example, hand sanitizer, sterile linen, forceps, disposable glove, gauze, cotton ball, needles, and isopropyl alcohol swab, or anything equivalent for us to clean the needling site. These things are supposed to be sterilized. So when you are packing the travel pack, it is optimal for you to, and it is also recommend for you to pack those sterilized things separately into a Ziploc bag. Other things that are not necessary to be sterilized, for example, the plastic lined bag for clinical waste or the portable shop container, you can put it in a separate bag. Or at least you have to separate the sterilized stuff and the non-sterilized stuff. And other equipment included clean paper rolls or the consent form or and writing paper that you would need for the patient to sign and for you to take record. This has to be included in the travel pack as this also necessary supplies and equipment, but they are not required to be sterilized. So the main point is never mix up those sterilized equipment and supplies with those that are not necessary to be sterilized or even deemed to be dirty. Okay. So let's continue on the other topic on the draping patient. Well, our college practice standard includes the how to drape patients. In generally, it involves draping patient with professionalism, and it is used to protect patients' dignity and privacy. We should perform the draping with explanation and obtaining patient's consent, and that should be using appropriate and clean materials for the draping. And one main principle for draping the patient is to minimize the chance of the needles being left over or being dragged by cloths. So when you are performing acupuncture, draping is so important, especially when you are needling the areas that is originally covered by the patient's cloth. These are the example of appropriate draping. So for example, when patients are with their clothes, and you don't need to needle the area that are covered by cloths. You can just simply rolling up the sleeve and loosening the trousers or the top or the clothes to expose the necessary area. And for this, you don't need any extra towel to cover the patient. And at the backside, if you if you are treating the area on the lower back or on the lower limb or on the extremities, the upper limb, there's no need to drape the patient because you can easily roll up the sleeve and or the trousers and to put up the clothes to expose the necessary area without having undress address the patient. However, when you are about to needle the area that involve undressing, in that case, draping is necessary, and you have to drape the patient in an appropriate way so that you can expose the area of the needling while maintaining the patient's privacy. And this is exceptionally important when you are treating a patient with opposite sex or not similar not identical to your sex, because this can create some kind of issue when you are treating the different sex patient. Remember that the degree of undress must be based on the treatment requirement. So we have to make ourselves very clear that which area is involved during the treatment. If that is necessary, tell the patient, ask for their consent to do the undress. Otherwise, don't recommend any unnecessary undress. Unless with specific treatment needs, remember that the underwear should be remained dressed. This applies to both male and female patient. Well, normally we don't need that to expose that area. Okay? In most of the case, we don't need to expose the area that is covered by the underwear. So it is best for you to let the patient remain dressed. But if the full undress is really needed, at least the female breast and the patient's genitalia in both sex, in male and female patients, the genitalia part and also the gluteal cleft has to be properly draped. Well, sometimes, of course, when we are, for example, treating low back pain, we need to needle the area in the sacral region or the hip region. Sometimes we need to expose the gluteal cleft. But if that's not the case, remain dressed or at least properly draped. Don't expose that area unless it is totally necessary. So that's all for today. Thank you for watching this video, and we'll see each other in the next class in person. Thank you so much, and have a good day.